To trust somebody to operate on your brain is kind of the ultimate relationship. In the old days, neurosurgeons opened the head without really having much idea what they would find or where it would be. And now we have ways of imaging the brain that are very precise. The brain is filled with tracks, millions and millions. I call it sort of wading through the bowl of spaghetti when we see these images. So we wanted to give people a way to, in an assisted fashion, find the tracks of interest. It's very, very analogous to what having GPS on your phone has done. You can get information that helps you know where you are in near real time or real time, which helps you avoid getting lost or gets you where you want to go most quickly and efficiently. Every brain is different. There were general rules about where critical brain areas were, but those were not always precise enough to tell us about individual patients, because we all have some variation in how our brain is organized. So we're interested in one patient at a time. The fundamental paradigm of surgery is you see with your eyes and you do with your hands. But the brain is not color-coded. The entire brain looks the same. It doesn't say this is a critical language area, this is a critical motor area, or this is an area where there's some redundancy. It all looks exactly the same. The imaging can give us a better view in some ways than surgery, because imaging shows us the forest, whereas during surgery we're seeing the trees. This is definitely in all aspects a team effort. It requires a lot of expertise, from scanning to image analysis to neuroscience, and that really has allowed us to do this sort of extreme level of personalization and planning even before we get into the operating room. By having a lot of pre-operatively acquired patient-specific functional maps, we can make a much more informed choice about who should have awake surgery, and those can be very taxing for the patient and the surgeon. In my practice, it's resulted in far, far fewer patients needing to have awake surgery. I mean, I have really always been interested in the brain, and while I've been talking a lot about the science, the reason I do what I do is because I love taking care of patients, and I love being able to tell people who have a problem in their brain, we have the tools, we can take care of this, we can get you through this safely.